Okay, there we go. Okay, can everyone see that?
Yes.
Yep, okay, great. Well, good morning, everyone. My name is Dr. Andrew Kushnir. I'm a veterinarian based in the US, somewhat based in the US. I've been traveling quite a lot the last couple of years. As Daria mentioned, I spent quite a bit of time during the first year and a half of war in Ukraine, on the ground, helping animals, helping where I could, helping people by helping their animals. My father is from Ukraine. He was born in a small village outside of Dnipro, and he was born during World War II, so his family were refugees who fled Ukraine at a time of war and lived in a refugee camp in Germany for 10 years before finally coming to the US. So last February, when Russia invaded Ukraine, I pretty much dropped everything in my life and I left my job because I was determined to help over in Ukraine. I felt it was my duty as someone who came from a refugee in Ukraine at one point to do what I could. So yeah, this is kind of the start of my experience working with animals in shelters and in sanctuaries in Ukraine. A little bit about myself in general. I went to school at St. George's University. After I graduated, I completed a shelter medicine internship at San Diego Humane Society. San Diego Humane Society is one of the largest animal shelters in the country, and objectively, it's one of the best managed shelters that I've ever worked at. It was a great experience to really learn the ins and outs of what it is to shelter animals. After my shelter medicine internship, I completed a wildlife medicine internship. This was working with animals native to Southern California, animals ranging from little hummingbirds to mountain lions, raccoons to black bears. And doing these two internships back to back really equipped me with the tools to be able to really travel to centers worldwide and be able to share the knowledge that I gained and also to implement some of the better protocols to improve animal health. So the last 2 years, ever since that finished, I've really been traveling abroad. I work at a lot of wildlife sanctuaries and animal rescues, helping to improve animal health protocols. I'll do specific projects for certain organizations, but overall, I'm sharing information that I've learned has been proven successful with facilities that are open to learning more about improving animal health, which really brings us to this topic today of optimizing shelter health in Ukraine. I have spent quite a bit of time at various shelters in Ukraine. At the start of war, in March of 2022, I was working with an organization called IFAW, the International Fund for Animal Welfare, at the border of Poland. This was one of the most heavily trafficked border crossings between Ukraine and Poland. We set up a big, beautiful blue tent about 100 feet from the border crossing. And we were the only animal tent at this humanitarian village that kind of just erupted out of necessity to help refugees as they crossed into Poland from Ukraine. I was there for about 3 months, and we helped about 1,500 animals over the course of those 3 months. The clinical picture of the animals that we were seeing ranged from totally healthy and very well outfitted, like this cat up here, to animals with severe dehydration, malnutrition, open wounds. Those first few weeks of the war were very very, very rough to see on the ground. This was when millions of people were moving throughout Ukraine and moving out of Ukraine. Lots and lots of people were bringing their animals to safety with them. And it was very fulfilling to be able to help Ukrainians during this time by helping their animals. And yeah, it was a very very profound experience. Difficult to put into words, but I'm really grateful for the experience to have been able to help over there how we did. After a couple of months, I returned to Ukraine, and this time last year, I was volunteering at a vet hospital in Odesa. It was a hospital that saw mostly exotic animals and some wildlife. I was able to perform a couple of orthopedic procedures on some wild raptors, such as this long-eared owl. This owl here was actually brought in by Ukrainian soldiers. They had found the owl on the front line. At this time, Kherson was still occupied by Russia. And these soldiers had found this owl on the front lines there. We were able to perform surgery. He stayed with us for a couple months for rehabilitation. And the soldiers actually were able to pick him up at the hospital, and they released him where they found him. It was a really great success story. I visited a number of frontline villages during my time there, supplying food to folks who had stayed behind to take care of animals. It was very common to see, and it still is very common to see, villages that are mostly abandoned, but there are still a couple of people around who are taking care of all the animals in the town. So yeah, not uncommon for one guy to be, feeding 40 to 50 dogs and cats every single day because there's no other food sources around. This bottom picture here, this is at a shelter in Odesa. We're going to be talking about this shelter later on, but this type of environment is a very common setup, not just in Ukraine, but also worldwide. This is a very common environment for animals to be sheltered in. And yeah, as the presentation goes on, we'll kind of familiarize ourselves with this particular shelter. And then at some point, I somehow got involved with the black market animal trade and the transport of what started as 3 African lion cubs quickly became 4 African lion cubs and a black leopard cub. It took many, many months to take care of these animals while waiting for permits to legally transport them across international lines. And it was about a month that I spent in Poland taking care of those cubs before they were able to come to a sanctuary in the US, where they are all thriving now. I could probably do a 2-hour webinar just on that experience of taking care of the lion cubs and the ins and outs of international permitting. But for the sake of this presentation, we're going to continue with domestic animals. My most recent trip to Ukraine was last April. I was asked to join a group that was going to be supplying a animal shelter in Kherson. This was several months after the liberation of Kherson. While we were there at this shelter, it was a very new shelter. They weren't overcrowded. They were being very careful of how many numbers of animals they were taking in. They were prioritizing animal health. It was great to see. While we were there, there was active artillery, hourly, being the front line that it was. We brought supplies to the shelter, and my job was to train shelter staff on how best to manage medical cases and possible surgical cases with the tools that we brought. We also brought some diagnostic equipment, such as the digital X-ray and portable ultrasound. And then just in general, I travel a lot. I find it very fulfilling work to be able to coordinate with sanctuaries worldwide and wildlife centers and animal shelters to be able to share knowledge, to be able to build cooperations. This past July, I was in Uganda. I was helping to conduct the annual health exams of chimpanzees at a chimpanzee sanctuary. This, of course, was in Kyiv with one of the lions. This is at a wildlife center that I work at. That's a raccoon. This was in Costa Rica, the sloth, and this was on the border of Poland and Ukraine. Okay, so here's our agenda for the next hour or so. We've already done the introduction. Hopefully you know a little bit more about me and about what I do. We'll really be starting this presentation talking about the principles of shelter medicine. So really the core basics of shelter medicine. What is shelter medicine? Why is it different than other disciplines? What are some special considerations for practicing medicine in the shelter setting? We'll be touching on the limitations in animal sheltering, and this is more supposed to be a self-reflection for shelters. So shelters themselves, considering their own limitations, it's important to have a capacity for care. It's important to know the numbers of animals that a shelter can reasonably take care of without overcrowding. And we're really going to be starting from the ground up. I even have a slide on disinfectants and a slide on what a proper quarantine and isolation area should look like. And this is really important stuff because I've seen what a lot of shelters are like in Ukraine. And I can tell you that with really good biosecurity, routine deworming and flea and tick medication, appropriate vaccination, and spay and neuter, a lot of health issues can be resolved or greatly alleviated just from those four things if a shelter is able to do those. So we'll be really going into the meat of those principles. We'll wrap it up with some of the common diseases that I've seen at animal shelters worldwide. This is by no means supposed to be an exhaustive, in-depth analysis of these diseases, more so just an overview and kind of some general tips for diagnosing, treating, and managing these diseases. We'll leave some time at the end for questions, but I will pause throughout the presentation at various points to see if anyone has submitted any questions. Okay, so we're going to pause here. This is a picture of a shelter in Odesa that I was at about a year ago. And I want us all to kind of appreciate the environment, appreciate the kennel type of structures that the animals are being kept in. This is a very common approach to sheltering animals, not just in Ukraine, but worldwide. This is a very common type of setting. And for those of us who live in North America or European Union, this might seem strange or different because we're used to shelters being a little bit more organized, but this is the reality of shelters in a number of places in the world. This particular shelter was run by 3 babusias. There were about 400 dogs in this facility. And every single one of those dogs had the ability to have direct contact with every other dog. It wasn't uncommon to see, piles of feces, piles of vomit, puddles of urine, and other bodily fluids. This is not passing any judgment. This is just a reality of what sheltering can look like in certain places. We're going to be referencing and referring back to this shelter again and again throughout the presentation because it's a good example of where there can be areas for improvement. I was able to secure 400 rabies and distemper vaccines and enough dewormer and flea and tick medications for all the dogs there. And over the course of a couple of days, me and one of the babusias went systematically to each dog and we vaccinated, we dewormed, and we gave flea and tick preventatives to all those dogs. And it felt good. It was good to give them some immunity with the vaccines. Realistically, the environment isn't getting disinfected. So all the intestinal parasites that the dogs already had are shedding in the environment. They're going to be persistent in the environment until, the floors, the walls, the surfaces can be disinfected. So that's why we're going to be going into disinfectants at a later point in the presentation. Okay, so shelter medicine is the field of medicine dedicated to the care and needs of underserved animals. So underserved animals can be animals on the street, stray animals, animals who were abandoned, animals who were relinquished by their owners. Very applicable in Ukraine is animals who have been left behind when their owners had to flee suddenly. It's important to note for folks who aren't familiar with the stray animal population in Ukraine. Ukraine before the war had lots of stray dogs sort of roaming around. It wasn't uncommon to see stray dogs even in some big cities like Odesa. Very common to see stray dogs out in fields. It's very similar to the community cat, similar to community cats in the US, where we have cats who are living outside. They're not domestic. They don't want to be close to humans, but they frequent, multiple houses for food sources. They know where the shelter is at. They know where the warmth is, and they know where the resources are. So it's very similar with dogs in Ukraine. The war, especially the first few months of war, I would say really exacerbated that issue because, millions of people were suddenly fleeing from certain areas and leaving a lot of these dogs without resources. General medicine and surgery, of course, play a large role in shelter medicine. Ultimately, if you're the veterinarian and you're looking at a sick animal or an injured animal, the medicine is going to be the medicine. But shelter veterinarians must have a thorough understanding of epidemiology, infectious disease control, policy development, and facility management. What I mean by facility management is knowing the ins and outs of the shelter. So knowing what kind of disinfectants are being used, how often are surfaces being disinfected, knowing the movement of animals within the shelter, because if there's an infectious disease outbreak, you're going to need to track, where did this animal go? Who did it have contact with? Can we quarantine this area? Can we isolate these animals? I like to think of animals that come into the shelter as sort of honorary pets. Those of us who are working at the shelter, we are their honorary family. And it's our responsibility to take care of them because they're in our home. And the shelter is our home. And it's important to know the ins and outs of our home. When I say policy development here, I'm referring to legislature. And this is because shelters provide a public service. It's in the best interest of the general public not to have lots of stray animals on the street. It's safer for people, it's safer for animals not to have stray dogs roaming around, stray cats roaming around. In the US, and I'm gonna guess in the European Union as well, most shelters are subsidized and funded by local governments because the shelters are providing a public service. I'm not sure if that's the case in Ukraine, but this is an aspect where policy development, lobbying your local legislature to provide funding for local animal shelters is really important because it is providing a public service. Continuing with public health, shelters are generally sentinels for disease. And what I mean by that is if there is a disease that's in a village or a town or a city, and it's going to be spread amongst dogs or cats or even wildlife, shelters are generally one of the first places you're going to see that disease process. And that's just because of the sheer number of animals that are coming in and leaving the shelter. On the flip side, shelters are also amplifiers of disease because you have so many animals in a confined space. So when you have so many animals in confined space and there's the risk of infectious disease, the propensity for amplification is very, very high. And I think back to this shelter in Odesa that had 400 dogs. They all can have direct contact with each other. If a new dog comes in with, let's say, dormant distemper virus, or the distemper virus is in the incubation period, after 2 weeks, it starts showing signs. Well, it's already exposed potentially 400 animals. And you can't talk about shelter medicine without talking about spaying and neuter or sterilization. Every shelter should spay and neuter every single animal that comes into the shelter. Spaying and neutering every animal that comes in is going to lead to less unplanned births and therefore less unnecessary suffering. Also, spaying and neutering every animal that comes in is going to limit the future numbers of animals that are going to come into your shelter. And this is important because animal shelters are temporary solutions. So I know a lot of times shelters are looked at as the end all. So you see a dog that's on the street, you see a stray animal, you pick it up, take it to the shelter, and you think, okay, the job is done, the animal is saved. Well, no, inherently shelters aren't designed to provide long-term or lifelong care for animals. So that's why pathway planning is always so important whenever you're bringing in a new animal to the shelter. I'm going to stop here and just see if there's any questions so far. I know we haven't really gotten into any medically specific topics yet, but I really want to hit home just these general principles of animal sheltering. So I'm going to try to find the chat box. Daria or Laura, I'm not seeing the chat box. Would you guys mind letting me know if there's any questions so far?
I don't see any in there right now, Andrew, but just a reminder to everyone, the Q&A box is at the bottom of your screen, and you can put your questions in there throughout Andrew's presentation, and he'll answer them periodically.
Okay, great. So I'll continue. Okay, one of the main reasons why shelters should be considered temporary solutions is because they are very high stress environments. Some shelters can be extremely loud and noisy. Overcrowding is very common at shelters in certain countries. There's commingling of animals. Thinking back to the shelter in Odesa, where there's 400 animals sharing one space. They're commingling, they're all interacting with each other. There's stressors, some of the dogs are, attacking other dogs, barking at other dogs. We know that high levels of stress leads to a lowered immune response, which leads to sick animals. So right off the bat at your shelter, reducing stress, reducing overcrowding, reducing commingling of animals is gonna lead to reduced disease. So just by creating a less stressful situation for your animals, you're going to reduce the overall prevalence of disease. It's one of the quickest fixes. It's one of the easiest things that shelters can do to improve the overall health of their animals. Overcrowding is the greatest risk factor for disease outbreaks in shelter populations. So knowing your capacity, if you are a shelter, if you're working at a shelter, knowing the capacity, the maximum number of animals that you can reasonably shelter is super important, because once you're at that number, you really need to think about not taking any more animals in, diverting those new animals to other locations. That way you can maintain appropriate spacing and appropriate care for the animals you already have. So reducing overcrowding is going to lead to reduced disease outbreak. So simply by reducing the stress and by reducing overcrowding, you're going to be reducing a lot of disease. It's obvious to all of us that dogs stress cats out. However, I very often see dogs and cats being sheltered in very, very close proximity to one another. Even though a cat can't see the dog, if there are 200 dogs that are barking and the cat is being separated from the dogs by just a wall, those cats are going to be extremely stressed. And a stressed cat in the shelter setting is a recipe for disaster. So for cats, especially, housing them in far areas away from dogs is really important. Having noise barriers, having visual barriers, whether or not that's, putting a towel over the cage front. If they're in an open area, at least having some kind of visual barriers so they can't see dogs, because just seeing dogs can be really stressful. Also providing cats a place to hide, like a hide box or a carrier, something where they can escape into to feel some safety. Okay, like I said, we are going to talk about common disinfectants. There were a few questions submitted about disinfectants, so here we are talking about common disinfectants. These are the two that I'm most familiar with using. Clorox or bleach is definitely the most readily available disinfectant. Diluted 1 part to 32 parts is generally adequate to inactivate most viruses. The thing with using bleach to clean is that, or using bleach to disinfect, sorry, is you need to clean the surfaces first. This is because bleach doesn't have a detergent property. So first you need to clean the surface of debris before applying your diluted bleach to disinfect. With bleach, a 10-minute contact time is recommended. Probably my favorite disinfectant, and yes, I do have a favorite disinfectant, is Rescue. It's an accelerated hydrogen peroxide. It comes in these concentrate liquid forms. It also comes in spray bottles. Excuse me. It has inherent detergent properties, so you can use it to clean and to disinfect. And generally a 1-minute contact time is sufficient. Other tips to keep clean. These might seem obvious, but when you're in the shelter setting, a lot of these things get overlooked. And when you overlook biosecurity, you're really asking for increased disease prevalence. So tips to keep clean in the shelter setting: allow surfaces to fully dry, especially wood surfaces or porous plastic. If these surfaces are constantly wet, bacteria is going to get in there, fungus is going to get in there, viruses can persist there. Eggs from worms can get in there. Allow these surfaces to dry before you're disinfecting them, and regularly disinfect all the surfaces that you can possibly disinfect. The better you are with biosecurity, the easier it's going to be to manage diseases when they occur, and also to prevent diseases from happening. You want to make sure that closed areas have adequate ventilation. It's not going to do an animal good if you're keeping it in an area with no windows and no access to a breeze at all. You're asking for a sick animal there. And it goes without saying, clean urine, feces, and bodily fluids regularly. Okay, quarantine and isolation. I was really happy to see some questions submitted asking about quarantining and isolating. Every shelter facility that's going to be housing a number of animals should have some area of that facility designated for quarantining and isolation. Infectious disease is inevitable. Even in the best funded, most modern shelter hospitals, infectious disease still occurs. It's considered a fact of life. Now, what sets infectious disease outbreaks apart is how is the outbreak managed. So having a quarantine space, having an isolation area where you can move animals either suspected of having disease or confirmed with having disease, being able to isolate them from the general population is really going to determine how that outbreak travels throughout the shelter. Wherever your quarantine or isolation space is, you want to make sure that it's an adequate size and that it's an adequate space to keep certain individuals for prolonged periods of time. Sometimes animals will need to be quarantined for weeks or months, as is the case with ringworm or dermatophytosis. The quarantine location should be located well away from heavily trafficked areas. So it's not going to be at the entrance into the kind of the main shelter area. It's going to be off to the side where people generally don't go. You want to avoid contamination, pathogens being picked up on shoes or on clothes and transported to the general population. You want to make sure that the general population of animals in your shelter can't accidentally get into the quarantine space. Ideally, all of the surfaces of the quarantine space should be easy to disinfect. And I know this is ideal. Some of the shelters, most of their kennels, most of their spaces are built out of wood. If that's the case, you just have to do the best you can to really make sure that you're disinfecting those surfaces once an animal is placed in that isolation area, and also when an animal leaves that isolation area. You need to have supplies designated solely for that quarantine area. So this is going to be your medicines, your syringes, your needles, all of your personal protective equipment, such as disposable gloves, disposable gowns, booties, and face masks. All that stuff is going to get designated for quarantine, and the only time that it leaves quarantine is inside of a trash bag. So I hope that makes sense. It's really important, even if you don't have the most disinfectable space, having a designated area of the shelter for quarantine is super, super duper important. Okay, this is my dog Henry. This was 2 Easters ago. He's wearing his Christos Voskres shawl. Okay, so limitations in animal shelter. We're all very familiar with the financial restrictions associated with animal sheltering. These are animals that have no owners, so the shelter is the one who's eating the costs of care, food, access to veterinary care. What I really want to challenge animal shelters or folks who are working or managing animal shelters to consider is, what is your capacity for care? So each animal shelter should have a number. They should figure out, based on the space that they have, based on the amount of food that they have, based on the amount of staffing that they have, they should figure out how many animals can be reasonably sheltered here. And once you have that number, you need to figure out what to do once you've reached that number. Because once you've reached that capacity, once you reach the maximum number of animals that you can reasonably shelter and provide a good quality of life for, if you admit new animals, you're going to dramatically reduce the quality of life for all animals. So if you are a shelter and you can reasonably shelter 100 dogs, you have space, food, veterinary care available for 100 dogs. If you have 100 dogs and 10 new dogs come in, now you have 110 dogs. Well, the overall care of every single one of those animals is going to be lessened. The more animals you bring in, it's going to continue to be less and less and less. So I know there's this mentality at animal shelters of trying to save them all, trying to shelter them all. It's just not feasible. And it's a common theme at all animal shelters worldwide, in the US, in Ukraine, in India, all around the world. Everyone wants to save them all. But there are other options for animals coming into your shelter. So knowing your limitations on admitting new animals once at capacity is super, super important, because you don't want to lessen the quality of life of the animals who are already in that shelter. So some questions that shelters can ask themselves before accepting new animals is, does this animal need to be admitted to this shelter? Is it someone who is relinquishing their pet? Can they keep the pet? Maybe they just need help with food. Maybe they need help with veterinary care. Can your shelter provide some extra food for this person so that they can take care of their animal at home? Can this person relinquish their dog or their cat to a neighbor or to a family member? Are there any other options besides coming into the shelter? Can it be managed in the wild? So again, we're going to talk about the stray animal population in Ukraine. There are a lot of dogs, a lot of cats in Ukraine who have been living their lives out in the wild, avoiding humans. Maybe they approach humans, but mostly they keep their distance from humans. Does this animal need to come into the shelter? If it comes into the shelter, it's going to be extremely stressed. It's going to be in a totally new environment. It's used to being free and open in the wild, and now it's going to be in a confined space, surrounded by other dogs, surrounded by people. It's going to be highly stressed out. When it's highly stressed out, its immune system is going to get depressed, and then it's very likely to get sick. Also, what's the goal of bringing a stray dog or even a feral dog into the shelter? You bring it into the shelter, it's likely not to get adopted because of its behavior. Unless you can go through, extreme behavior modification or behavioral work with the dog, this dog is likely never to be adopted by somebody because it's a health concern. It's a injury concern. So can this animal, let's say it is a stray animal, can it be managed in the wild? If it has an injury, can you set up a trap for the animal? Can you trap it? Can you anesthetize it? Can you sterilize it in the field? Can you manage the wounds with long-term antibiotics? Is there any way to maybe medicate it by leaving food out? So there's a lot of options to explore before even bringing in an animal. Essentially, can the animal go anywhere else? Another limitation is the staffing. A lot of shelters, most shelters I'd say, have limited staff. It's just kind of inherent in the shelter world. There's not as much funding. There's not as much funding available for people. Lots of shelters have great volunteer programs, which is amazing. They help with the cleaning, the feeding, the running of the day-to-day operations. But it's also something to consider if you are at the capacity for the number of animals that you can hold. So if you're at your capacity and you can only hold 100 dogs at your shelter, if you add another 10 dogs in, that's going to be more work for the staff and your volunteers. If you add another 20 dogs in, it's going to be even more work. So trying to maintain a balance between reasonable outcomes and reality is really important. And yes, is there quarantine space available? Okay, I might stop here and see if there's any more questions. I've been trying to locate the Q&A chat box on the screen, Laura, but I'm not able to see it.
No problem. We've had a couple come in here, Andrew. I can share them with you, and then maybe you can answer them.
Okay, sure.
So, first one here is, are foster homes for pets difficult to find in Ukraine due to the war?
Our foster homes. Well, I know of a few foster homes right off the top of my head. Some folks that I've worked with through a couple of different organizations. Really, it's just knowing it's just knowing the right people and being in the right city at the right time. But yeah, they are available.
Yeah. Okay. Great.
I also know quite a few in Poland. So.
Okay. Oh, that's good to know that they're cross-border. This question is from Lindsay. What is it like to manage capacity in places in Ukraine where turnover is low?
Lindsay, that is a great question, and I really wish I knew the answer. I have the same question, actually. not all shelters are created equally. The shelter that I've been referencing in Odesa with the 400 dogs run by the three Bogusias, that's just one type of shelter. There are also other shelters that are very well managed. The animals are kept in these nice big runs. The runs are maintained. They're clean. They have access to veterinary care. They're regularly dewormed. The shelter that I visited in Kherson last spring, that was actually a really great shelter. It was very new. It was just started by this couple, and they were very aware of avoiding overcrowding. So they were actually only taking in dogs that had been abandoned as a result of people fleeing the city. So these were animals who were already owned. So they're already used to people. They're already good companion animals, and they're likely to get adopted versus the stray dog that has been living out in the field, who's less likely to get adopted because of the behavioral characteristics. In terms of managing the shelters with the turnover, I would have to defer to someone else with more long-term knowledge of shelters in Ukraine. A great question.
Thanks for that. Thanks, Lindsay. In Ukraine, this is from T. Are there TNR programs for dogs as well? Or are there dogs that come into the shelter and stay there until they open up?
Yeah, that's a great question. There definitely are TNR programs. At the beginning of this presentation, Daria was talking about Veterinarians Without Borders programs of doing targeted spay and neuter. I know of a couple of organizations that are actively doing or have actively done TNR in Ukraine very successfully. The issue is there's just so many stray dogs and stray cats out there. But you have to start somewhere, and yeah, you have to start somewhere. At shelters, it depends on the shelter. I guess I should have explained this. Shelters in Ukraine are set up rather differently than shelters like here in the US or Canada or the European Union. I would say generally at large animal shelters here in the US, there's a staff veterinarian or multiple staff veterinarians. At San Diego Humane Society, where I did my shelter training, we had, I think, 16 staff veterinarians and a huge medical staff. So we were able to provide point of care medicine for every animal that came into the shelter. That's not feasible in Ukraine currently. The way that shelters, this is my understanding, the way that shelters function is they will generally partner with a local veterinarian, and whenever they have significant concerns, they will contact the local veterinarian to help manage the issue, whether it's a medical issue or a surgical issue. Or those local vets will routinely come to the shelter, maybe once, twice, 3 times a week. But it's very uncommon for an animal shelter in Ukraine to have a veterinarian or veterinary staff on site 24/7.
Thanks for that, Andrew. That makes a lot of sense. 2 more questions here. First is, do we have any info about if pet adoption rates have changed at all due to the war?
That's a great question. I would be interested to see if there's any info out there. I don't know if there was any info out there prior to the war, so I don't anticipate that there would be any information like that. I will say that since war, there has been a lot of international interest in helping to exit animals out of Ukraine. A huge interest. I know of a lot of Ukrainian rescues and smaller shelters that actively transport very adoptable dogs and cats from Ukraine into the European Union, where they're readily adopted. Of course, they have all their proper medical paperwork, and they're properly vetted before crossing international lines. But yeah, in terms of domestic adoption rates in Ukraine, I don't know. I really don't know. I would assume, actually, I wouldn't know what to assume. Wouldn't know what to assume.
Yeah, it may be that Daria has information, but I'm not sure. But at the end of your
Yeah,
presentation, if she does, maybe she can share that.
yeah, I would love to know if there's.
Yeah, if there's any info. I'm not sure if she does, but we can find out certainly. Final question here from Darlene. How do you deal with the stress and trauma experienced by animals during the war?
I'm sorry, could you repeat the question?
Yeah, I think Darlene is asking, how do you personally deal with all the stress and trauma of sort of seeing these animals who are in these really stressful situations due to the war?
Um, yeah, I guess I would respond by when I'm over in Ukraine and I'm in these stressful areas, especially near frontline areas. Um, I am more sympathetic and I feel more for the people who are experiencing the horrors that are happening over there. And I find comfort in helping the animals because it's a way for me to actively do something. You know, I can make an animal feel better. I can help to, manage a disease. If it's in pain, I can help manage its pain. If it has a fracture, I can help manage its fracture. So by helping animals, I'm helping people, and that's kind of how I process it. I have seen, of course, animals who were, injured as a result of artillery or bombs, and of course, animals who were stressed out from constantly hearing the sounds of artillery. But I see it a lot in people as well. And as much as I'm over in Ukraine to help animals, I'm more so over there to help people by helping animals. So there's a ton of Ukrainians who they want to take care of animals. They want the tools, they want the skills to be able to take care of these animals. So by helping the animals, I'm able to help those people. I'm not sure if that makes sense, but that's kind of how I reason and how I process that.
Yeah, that's great. Thank you for sharing that, Andrew.
Sure.
That's it for the questions for right now.
That's it. Okay, cool. I have an anecdote. We were talking about fosters in Ukraine and Poland, and this is going to segue into our next topic of pathway planning. When I was on the border at the refugee camp, there was a number of international animal rescue organizations that came from North America and from European Union. They wanted to do something. They wanted to go into Ukraine. They wanted to save, Ukrainian animals and bring them back to the European Union. So what they would do is they would rent vans or trucks, and they'd get a bunch of carriers. They'd go into Ukraine. Usually they'd stay in Western Ukraine, somewhat far from the front lines. And what they would do is they would just drive down the streets and they'd pick up stray dogs, and then they'd bring them back to Poland, and they drop them off at a shelter, and they pat themselves on the back saying, "We saved Ukrainian animals from war." Well, the reality is a lot of those animals that they picked up probably were somewhat owned by somebody, or were, stray animals that kind of frequented a community. They knew where all the food spots were at. They knew where the shelter was at. And now their whole lives were changed. They were essentially abducted, taken across the border into Poland, and then dropped off at a shelter. Well, I followed up with a number of these dogs because I was in Poland for several months. And a lot of these dogs, they did terribly in the shelter. They weren't used to being in a confined area. They weren't dogs that were meant to be adopted. They were dogs meant to kind of live their lives out beneath the open sky. So no one was going to adopt these animals. They didn't have the behavioral temperament for adoption. And because they didn't have the behavior for adoption, they just sat in the shelter, and they sat and they sat and they wasted away. And it broke my heart because here were some folks who were, of course, well-intentioned. They wanted to save Ukrainian animals during the war, but they had no pathway planning. They weren't thinking long-term. They were thinking, go save dog, drop off at shelter, and that's it. This goes against, one of the things we were talking about earlier. Animal shelters are temporary solutions. And if you don't have a long-term plan for an animal, why bring it into the shelter at all? Okay, that's the first anecdote. I have one more anecdote and then we'll continue on. This is about the fosters in Poland and Ukraine. Another one of these international organizations went into Ukraine. They went to Kyiv. Actually, they went to Bucha. And I'm just trying to remember this right. They picked up 3 or 4 puppies from a shelter there. And the puppies were young and they were not doing well. This is probably in April of 2022. So at this point, the international regulations at the border, all animals crossing into the EU needed to have proper documentation. They needed to have proof of vaccination and a health assessment. So these folks with the International Rescue Organization tried to take these puppies to Ukrainian vets to get a health certificate, but these puppies were sick and they were having diarrhea. So no Ukrainian vet would sign off on them having good health. Well, these folks were determined to save these puppies. And instead of seeking medical attention in Ukraine, they decided to smuggle these puppies across the border into Poland. They put them in a box and they hid the box underneath the seat of a car that they were riding in. They crossed the border, no issues. Then they dropped off these puppies at a foster home in Poland, close to the border, close to where I was working at the time. This foster also had a number of other puppies and no special biosecurity measures were taken. All the puppies were commingled. Everyone was playing together. Everyone was living and sleeping together. Well, I came to find out about a week later that every single one of the puppies that had come from Ukraine and was already being fostered at that home died. They got parvovirus and they all died because it was untreated. Just terrible. It just broke my heart. So, pathway planning for animal rescue is paramount. You need to have a goal. You need to have an end goal in sight, so that you can, have something to work towards. Because just picking up an animal and putting it in the shelter is not going to do anyone any good. Okay, I think that's it for my anecdotes for now. I'm sure there's going to be a few more along the way. Okay, pathway planning. This is kind of just a general schematic. So there's really 3 options for pathway planning for adoptable animals. If an animal is sick, if it is a stray animal that doesn't have the behavior for adoption, either it needs to undergo behavioral modification. You need to work with that animal to get it to open up and have a more positive temperament, or other options need to be considered for that animal. But generally, we have adoption, rescue, and transfer out. Adoption, of course, is as a pet, working animal, service animal. Rescues, this might be a foreign concept in Ukraine, or it might not be. I'm just not familiar with any rescue type facilities in Ukraine. But a rescue is generally a facility that can provide appropriate long-term and lifelong care for certain individuals. It's a great resource that a number of shelters in the US that we use when we have too many animals. We can contact these rescues, and generally these rescues will kind of specialize in a particular niche of animals. So some rescues only take in boxer dogs. Other rescues take in old dogs. It's a great resource to have, and I'm not sure if it exists quite yet in Ukraine. And then finally, transfer out for Ukraine international rescue groups. I know I just said a number of kind of bad things about some international rescue groups. There are far more good rescue groups doing good work out there. and who are currently coordinating with shelters worldwide. For the transfer out, you really should consider the likelihood of animals getting adopted. I'm going to I'm sorry, I lost my train of thought. I'm going to reflect on the stray dogs that were picked up in Western Ukraine and brought to Poland to the shelter. What is the likelihood of those stray dogs getting adopted once they're in the shelter? These are some questions to consider. Will the animals just sit at shelters abroad? So yes, you could transfer, if you're a shelter in Ukraine, if you're working at a shelter in Ukraine, and someone says, hey, we can take all of your dogs and all of your cats, and we'll take them to our shelter in Poznan or in Warsaw. Are those animals going to get adopted over there, or what's going to happen with those animals? So knowing what happens long term is really important. Okay, so now we've kind of gone through some of the general cores of shelter medicine and animal sheltering. I created this kind of mock day one protocol for a new animal, an animal that's just come into the shelter, and sort of a checklist for how to proceed with taking care of this animal. So if I was at a shelter and a dog came in, the first thing I would do was assess, does this animal need to come into the shelter? Is there any other place it can go? Can it go to a rescue? Can it be managed in the streets, on the wild, if it's a wild animal? Is there an international rescue group that can take this animal? If not, okay, let's bring it into the shelter. So second thing is do a full health assessment, really identify any possible disease. So mostly we want to focus on respiratory disease, gastrointestinal disease, diarrhea, neurologic disorders, skin issues. So these are going to be things that we want to look for because we're worried about infectious disease, because in the shelter setting, infectious disease gets amplified. If an animal has any of these issues going on and we're still taking it into the shelter, we should immediately quarantine it. We shouldn't mix it with the general population. Immediately put it in quarantine and then start treatment if it's appropriate. Okay, day one, if an animal is healthy and old enough, it should get vaccinated with core vaccines, dewormed, and receive flea tick medication all on day one. I know this is going to get a lot of hesitation from folks because it might seem like a lot, and it is. But when you're working in a shelter environment where you have lots and lots of animals, the benefits of giving all vaccines on day one and deworming on day one far outweigh the risks associated with a vaccine reaction. You can have animals who have dormant or incubating distemper virus who aren't going to show any clinical signs. And if you don't vaccinate on day one, maybe in 2 or 3 weeks, finally that incubation period comes to a head and you start to see clinical disease. Now you have an animal that has full-blown distemper and you've introduced it to your general population of animals. This is bad news bears. If you had vaccinated on day one, at least you would have given that animal some protection, some immunity to be able to fight off the infection. This is the protocol that we use at San Diego Humane Society. It's the protocol that most of the large animal shelters in the US use, regardless of, not regardless. If there's no medical history present, so that you don't have a physical documentation showing that the animal has been vaccinated, you vaccinate for rabies, and then the core vaccines, depending on if it's a dog or a cat, all on day one, all on day one. And they get the dewormer and they get the flea and tick medication. So consider that the next time you're at your shelter. Another reason why this is a good idea is because once you do it on day one, you can feel comfortable that when you introduce that animal to the general population, that they're going to be mostly free from exposing other animals to whatever they're bringing in. So you prep the animal that's coming into the shelter, and you also prep the animals that are in the shelter. So you're saving everyone. You also don't have to worry about keeping records of, okay, I need to I still need to vaccinate or deworm this dog that came in 3 weeks ago, or this one that came in 2 weeks ago. Immediately when they come into the shelter, if they're old enough and healthy enough, you do it all then and there. It's going to save you a lot of time, and it's going to save you a lot of headache in the future. Okay, next you want to schedule the sterilization. Again, every dog and cat that comes into the shelter should get neutered, should get sterilized. By not doing so, you're creating more work for your shelter and for yourself in the long term, and you're also going to be causing unnecessary suffering. Lastly, you're going to coordinate your exit. This, of course, is going to be determined on a whole number of factors. But always keep in mind the exit. What is the goal for this animal? Okay, Laura, real quick, how much time do we have?
We are about just 12 minutes over. So I would say if we maybe want to wrap things up in the next 10 minutes, that would be awesome.
Yeah, okay. Well, I have a whole bunch of slides. We're kind of getting into the actual medicine of the topic now, or of the presentation. So what I'll do is this presentation will be made available for everyone who's interested. And please use it as a reference if you would like. There's a lot of information regarding vaccinations, dewormers, flea and tick medication. We'll kind of I'll cruise through the next slides and we'll see how far we get. So this slide is really kind of outlining the core vaccines for dogs in the US and the non-core vaccines. Of course, this is all going to be dependent on region, and definitely follow up with your local laws regarding what is a necessary vaccine. Please use this chart as a reference. This is a great way to kind of get a gist of when to vaccinate. I got a number of questions submitted asking for vaccination schedules for dogs and cats. So this would be a great reference for you all. And same for vaccinations with cats. This is a schematic just to remind folks where the appropriate regions on the body are for administering vaccines to cats. The vaccine-associated sarcoma is pretty rare. We don't exactly know the occurrence rate, but I've seen somewhere between 1 and 10,000 injections. Again, this is a chart for cat vaccinations. Please use it as a reference for whenever you need. And sorry if I'm speeding through this. I just want to get to all of the slides just so we can get an overview. Prophylactics. Here's where I talk about deworming, flea and tick medications, and heartworm. Heartworm disease is a tough one if you're not able to test for it. There is heartworm in Ukraine, and unfortunately, I struggled to find the heartworm rapid tests available. So that might be something moving forward where more support can be given to offering heartworm antigen tests to veterinary practitioners in Ukraine, or even doing disease surveillance would be really important. These are some of the common dewormers that I use. I mostly, for the most part, use fenbendazole and pyrantel. They're the most readily available dewormers. And yeah, I generally use those, the most common. Routine vaccination, deworming, and flea and tick medication prevent innumerable disease, along with proper biosecurity and reducing stress and overcrowding. With all these things, this is going to be the foundation for running an animal shelter well. So if you're able to have good biosecurity, reduce stress, lower the overall numbers of animals that are commingling or cohabitating, routine vaccination, deworming, flea and tick medication, you've pretty much covered the majority of illnesses that animals tend to get in the shelter. Yeah, unfortunately, we have 10 minutes left. I'm not going to really get to even the general overview of these diseases. But in the following slides, I go through sort of the most common diseases that I've seen at shelter settings worldwide. Sorry, I'm just thinking now, I'm not going to have enough time to go into the disease processes. So I think if we're able to, this presentation will be made available to everyone, so feel free to peruse it. If you have any questions, maybe we can schedule another webinar where we can really focus on maybe the disease processes, and we can go really, really in depth as much as we possibly could. We talk about the kennel cough, giardiasis, parvovirus. Yes. This dog does not have distemper. This is a dog that I did a cherry eye repair on a couple days ago, and I just really liked her face. This dog did have distemper virus. Okay, I'm just gonna skip ahead then so we can kind of wrap things up. Yes, I would love to talk about sterilization. I could talk for hours about sterilization, especially targeted spay-neuter programs. I do a lot of targeted spay-neuter programs. I live about 5 minutes from Mexico, and I go often to Mexico to do these targeted spay-neuter programs. We go into a little village or a town. We set up our stations. The locals will bring their animals to us, or the locals will trap cats and dogs, bring them to us, and we will spay and neuter them and vaccinate them and give them flea and tick medication at the same time. It really works. You're really able to reduce the number of stray animals over time. It's also a lot of fun. You're able to accomplish a lot of good. I've attached a link here to the ASPCA. They have some great videos on tips for doing fast and efficient spay and neuter. Generally, in high quality, high volume spay neuter, a dog spay will take about 15 to 25 minutes. A cat spay, 10 to 15 minutes. To get these low surgery times, it's really just about practice and also learning tips for efficient surgeries. Maybe we could do a future webinar on just targeted spay neuters. Okay, I'd say to wrap up the presentation, that was a quick hour. Areas for focus for shelter medicine and shelters in Ukraine, I think if you're really able to improve the preventative medicine aspects and also improve biosecurity, you're gonna tackle and prevent a whole host of diseases. So much of the disease that I've seen in Ukraine and also in other countries stems from poor biosecurity, surfaces not getting disinfected, improper vaccination, deworming not being performed, and flea and tick medication being used sporadically. So if you're able to get on a good routine with all those things, you're going to eliminate a ton of disease, and it's going to be an overall healthier environment, not just for the animals, but for you as well as a shelter worker or someone involved in the shelter. And then, of course, targeted spay and neuter. This is directly going to reduce the number of animals needlessly being born and coming in the future. It's proven to reduce the number of stray animals over time, especially when compared to mass poisonings, which unfortunately happens in Ukraine as a method for reducing stray animal populations. But I'd say for those folks who are working in shelters who want to learn more about how to improve the health of shelter animals, these two things right here are going to solve so much of your problems: preventative medicine, targeted spay and neuter. I'm sorry we weren't able to go over the disease processes and some of the prophylactics with the time, but hopefully we can schedule another webinar if folks are interested, and we can really go more in depth with how to approach prophylactics and vaccinations and how to manage, treat, and diagnose a lot of these common diseases.
Thank you so much, Andrew. I'm sure I speak on behalf of all of our audience and our team when I say we could listen to you talk for hours about your work. So yeah, as Andrew has mentioned, we will make sure that these slides are available for everyone if you'd like to look a little bit more in-depthly into them. And we will make sure the webinar recording is also available if people would like to check that out as well. Thanks to everybody for making the time to attend today. We really appreciate it. And for more information about our work or Andrew's work, you can check out vetswithoutborders.ca, and we'll make sure that we have links to Andrew's social media so you can check out all of the amazing worldly travels and veterinary work he is up to. So thank you. And yeah, we so appreciate your time. Thanks again, Dr. Kushnir. Everybody.
Yeah, thank you for having me. So there's no questions?
No more questions.
Yeah, I know I had to rush through those last slides, and yeah, hopefully at a later time we can maybe we can explore more of those disease processes and
yeah, we can certainly talk about that. Totally. Yeah. Thank you for putting the slide presentation together. It was super informative and very, very interesting. I know we had a lot of audience interest in it. So thank you again.
Yeah, thanks for having me.
Okay. Oh, do we have one more question from Tatiana? Did you have a question? I see one raised hand. I think, Tatiana, if you do have a question, you can unmute yourself. Or did it pop up here? Oh, she just wanted to say thanks.
Oh, okay.
Awesome. Okay. Any other questions also, feel free to email myself. I didn't really introduce myself, but I'm Laura. I work at Veterinarians Without Borders. My email is laura@vetswithoutborders.ca. And I will make sure those questions get to Andrew if they are pertaining to this presentation. One final question here. I know we're over time, but from Michaela, she wants to know, do you see yourself eventually pursuing more wildlife-focused work in the future?
Well, I sure do a lot of wildlife work right now. I kind of split my time working at wildlife sanctuaries, wildlife work. I actually, last spring, I started a wildlife wellness service based in the state of Florida, which I act as kind of a point source on-site hospital for a lot of these sanctuaries, mostly doing wellness exams of wildlife ranging from snakes and turtles to wolves and bobcats and mountain lions. I definitely split my time. There's more reliable work in the small animal world. So the reality of life is that I have to pay my bills, and I work often with small animals, dogs and cats, to pay those bills.
Thanks for that. That makes a lot of sense. I think those are all of the questions. Daria has mentioned Elena has a hand raised. Elena, did you have a question? One final question for Andrew here before we wrapped up. I think, Elena, you can unmute yourself and speak if you'd like to. Or put your question in the Q&A.
Олена, у вас питання. Олена Кравченко. Доброго вечора і дуже вдячні за зацікавленість.
Good evening. I just wanted to say that we are very much grateful to you that you're interested in helping Ukraine. We are from Kharkiv, and here is the following question. What is the period over which you place an animal for quarantine before in shelters? I mean, that you first vaccinate the animal, and for how long is the animal staying in the quarantine area before he or she gets to the overall population?
Okay, I think I understand the question. So generally, if the animal has no concurrent illness and it's otherwise healthy and it's coming into the shelter, I've seen some shelters do a quarantine or at least an isolation, meaning keeping it isolated from the other dogs for 1 day. I've seen up to 3 days, up to 7 days. As long as you vaccinate it on day 1, then you can feel safe in knowing that it has some protection when it's in the general population of the shelter. So my recommendation would be to vaccinate on day 1 and then introduce on day 3 if it has no concurrent illness.
Great.
Дякую дуже. Несподівана відповідь, насправді, але дуже дякую за таку
This
відповідь.
answer came as rather
Так,
unexpected, but thank you
прошу.
very much for your answer.
І чекаємо стосовно стерилізації, бо нюанси
And we would be waiting very much for the webinar on sterilization because we have a lot of issues with sterilization, in particular in the area of the hostilities. It's a very relevant issue for us because we are close to the border on Russia, and this issue is very relevant for us. We need to know how to be very much effective and quick with the sterilization of animals. So we are looking forward to this webinar.
Well, I'm looking forward to helping you to achieve your goals, and yeah, I think we can put together something very productive, so we can help you and also help the animals.
Mm-hmm.
Awesome. Thanks so much for that question, Elena, and your response there, Andrew. I think we'll wrap it up at this point, but again, if there's any other questions for Andrew, feel free to reach out to us, and we will make sure that he gets that question. Okay.
Awesome. Well, thank you so much for having me, and hope everyone has a great rest of your day.
Take care, everybody. Bye, Andrew.
Bye.